Hi, this is Zoe from Carepatron, and in this video I will be guiding you through how to use the chest pain location chart. A chest pain location chart is a crucial diagnostic tool in the healthcare industry designed to accurately pinpoint the potential origin of chest discomfort. This chart typically features a human torso diagram, allowing patients to indicate the precise area of their pain. The chart's layout is divided into distinct regions, each corresponding to various potential triggers of chest pain. By marking the exact location of the discomfort on the chart, healthcare professionals can gain valuable insights into the possible underlying medical conditions causing the distress. This initial identification can expedite the diagnostic process and guide further examination and treatment plans. For instance, discomfort at the chest center often suggests heart-related issues. Conversely, pain experienced on the side of the chest could indicate musculoskeletal problems. However, it's crucial to remember that while this chart is an invaluable aid, a comprehensive medical examination is always required to accurately confirm the cause of chest pain. To use our free chest pain location chart, follow these steps. Download our chest pain location chart from the Carepatron platform, which you can find in the link in the description. Initiate the process by asking the patient to characterize their pain. It could be sharp, dull, burning, or squeezing. Understanding the nature of the pain can offer significant insights into its potential cause. Next, request the patient to indicate the exact location of their discomfort on the printable chest pain location chart. If the pain extends or radiates to other regions, it's essential to mark these areas too. The precise location can provide clues about what's triggering the pain. It's crucial to record any other symptoms that the patient might be experiencing alongside chest pain. These could range from shortness of breath and nausea to dizziness or fatigue. Documenting these accompanying symptoms can help paint a clearer picture of the patient's condition. Use the data gathered from the chest pain location chart to help identify potential causes of chest pain. The specific location and type of pain and other reported symptoms can offer valuable insights that guide the diagnostic process. Remember, the chest pain location chart is an aid to diagnosis, not a definitive diagnostic tool. It's vital to recommend further medical evaluation for the patient to confirm the chest pain's root cause accurately. This could involve ECGs, blood tests, or imaging studies.
Thank you for watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel or click on one of our recommended videos.